Dr. Amir, there's still sadly, a lot of stigma around infertility. It's very, very difficult, isn't it? It's really hard because a lot of people, I mean, she had to put up with people saying, oh, you're not going to have, you and Brad should have a baby and all of that. And it's that thing of you never know what people are going through.
Morning, Lorraine. Yes, that's absolutely right. Sadly, there is stigma attached to women who cannot have children, or those women who choose not to have children. It's almost like the entire worth of a woman lies within her uterus, which we, of course, know to be nonsense. And Jennifer Aniston is one of the biggest stars on the planet. She's achieved so much, but all of those achievements are diminished through these discussions around, is she happy because she hasn't had children? She should have had a child. All of those things that she talks about being discussed that upset her. And these are the kind of discussions I have with patients that come and see me around struggling to have children. Are women less than women because they can't bear a child? Of course that's not true. Are they not strong women because they haven't been through childbirth? Of course they're strong women. Or are they not resilient because they haven't been up all night with a screaming baby? Of course they're resilient. We need to go back to valuing women, whether they're mums or not, and remove that stigma.
Absolutely. There are many, many causes for infertility, of course. And sadly, there's a lot of help. But it tends to be sort of little pockets, doesn't it? It's a bit of a lottery as to where you live and how you're treated. And that's got to stop too. There has to be more fairness, surely.
Yeah, absolutely. There's so many causes. And, when you are in that fertility system where you're being referred, there's often long waits depending on where you live and what's available in that area. And it has to be fair across the board. When we look at couples who come in with fertility issues, we do look at the men as well as the women. Is there a problem with the sperm in that man? Is age playing a factor in the woman? Is there smoking, alcohol? All those things can affect your fertility. But again, in women, there are things that we will be looking at. Are they releasing an egg every month? Do they have a history of something called polycystic ovaries, where the ovaries become resistant to hormones and don't release an egg every month? May they be suffering with endometriosis, which is where the inside lining of the womb can get misplaced in different parts of the body and affect your fertility? Is there a problem with the fallopian tubes that attach the ovaries to the womb because of a past sexually transmitted infection, which is why it's really important if you feel you're exposed to a STI, you must get checked because it can affect your fertility. All of these things are things that we look at when you come in to talk to us about your fertility issues.
No, of course. And interestingly, Jennifer Aniston mentioned in that interview that she regrets not freezing her eggs. But that's not always straightforward either. That's the thing about things like IVF and all of these other options, which is brilliant that we've got them, but it's not straightforward.
It's certainly not. I do hear people say, if I don't find the right partner, I'll just freeze my eggs and have children later. People need to know that actually egg freezing isn't available routinely on the NHS. It's only available in exceptional circumstances. For example, if a woman is undergoing cancer treatment, which may damage her eggs, then we may then freeze her eggs. But more often than not, we freeze embryos rather than eggs. And if you do go privately to have your eggs frozen, it can cost anywhere around £5,000. And even then, there's no guarantee that those eggs will lead to a successful pregnancy and birth. So you've got to be really clued up on the decisions you're making now that can affect your future.
And also, I guess, don't leave it too late. There is that worry as well. The quicker you can get to the root of the problem and then hopefully get some sort of treatment, the better.
Absolutely. For women, sadly, there is a body clock. And we encourage anyone, if you're under the age of 35 and you're having regular unprotected intercourse and it's been a year and you haven't got pregnant, go and speak to your GP about that. If you're over the age of 35, don't wait a year. Certainly have regular unprotected sexual intercourse. I say 2 or 3 times a week you should be having it. But if you're over 35, don't wait any longer than 3 to 6 months. Go and see your GP because time is really of the essence. And there is a cut-off point at which we can't refer you to fertility services because of your age, and that will vary in area to area. So it's always worth speaking to your GP if you're struggling to get pregnant. We can help. There's lots of causes. Many of them are treatable.
Dr. Amir, as always, wonderful advice. Thank you so, so much.